Hi, my name is Dennis Bronston with ShadeWave, and we're going to go over how to take a ShadeWave picture. Let's start with cameras. There's two different classes of cameras. This is your digital SLR camera, and they all need to have a flash, whether it's a ring flash like what you see here or a twin flash, but you definitely need to use a flash. Also, we have the point and shoot cameras. They're all outfitted a little bit differently, but again, they can both work as long as they take a good clinical picture. Now, one of the important things to do, not only for ShadeWave, but just in general, is do what you call color balance your camera. Now, you do that with either white paper or a photographic gray card. Now, we prefer a photographic gray card because we feel that the pictures are just a little bit warmer. And what you would do is you put the gray card or the white paper down on your dental chair and go through the procedure outlined in your manual. I can't tell you exactly how to do it because all cameras are a little bit different. So why do that? It's because even though our eyes don't always pick it up, actually what's called the color balance of the lighting that you have in your room might be a little bit off. Now our eyes adjust, but the cameras don't, and that's why we color balance the camera. I'd like to introduce my brother Bob. He does technical support with ShadeWave, has many years experience in shade analysis and photography, and he's going to cover some of the issues of taking a picture with ShadeWave.
Again, my name is Bob, and I'm handling technical support with ShadeWave. So if you need that support, make sure that you call and ask for me. Now, what I want to do is I want to talk about the shade reference, the reference that's being seen within the picture itself. Dennis will be covering some of the things like how to position and how to hold it, but I want to cover a couple more things. And that is, sometimes we've seen pictures with the patient in the chair with big squares of light in the right in the middle of one of the teeth, and that's due to the large window sitting right in front of the patient. So if you see a picture with a big white square area in the middle of the tooth, hey, close the blinds. Also, the height of the chair. Try to get the chair up as high as you can and comfortably stand to the side of the patient, one side or the other, the side that's most comfortable for you. If the chair is too low, or if you have the chair back at 45 degrees, making it easy for you to bend down and take the picture, what happens is the shade reference, whether it be the handheld reference or on the shade arm, it doesn't make any difference. You're now dropping your arm down, and then this is going to be facing the fluorescent lights up on the ceiling. Your camera's flash only puts out the amount of light necessary to illuminate the picture. And with the fluorescent lights, we have seen either streaks of light in the shade reference itself and on the patient's teeth, or what we've seen is the black on here looking light gray from the brightness of the fluorescent light. So it's best to have the chair up as high as you can, have the patient sitting straight up, and just shoot right on. We've also seen some issues of, let's just say that you were doing the two centrals. Well, I've seen then the pictures of the two centrals, and that's not what we're trying to match. We're trying to match laterals. So what I want you to do is take a picture of the lateral if you're going to be doing the two centrals, or if it's a single central, go on ahead and take a picture of the central that you want the shade to come off of. If the tooth is a little bit more posterior, again, what we want to do is have the patient use retractors, and I've seen a lot of pictures without retractors. So retractors are really important. And the reason why is because we want to see the gingival margins in some of the pictures that they're coming in, and we're not seeing the margin at all. So use retractors, and if you're taking a picture of the upper teeth, retract out and pull up. If it's the lower teeth, retract and pull down. And if it's a little bit more posterior, we still want retractors used, but what we want is this side of the retractor maybe just to hold the lip open and then retract back, and then you'll be able to shoot a little bit more buccally, you know, as far as that goes. But now I want to talk about distance. Even though you may have a 35mm type camera and you could take a picture of only one or two teeth, that's not what we want. What does the technician want to see? The technician wants to see all of the teeth in the mouth. We want to see the staining, hypercalcification, all of the nooks and crannies in the valleys, and all the things that we want to see. So the distance, whether you set up the shade arm or the distance, when you hold this, the distance of the camera, it's going to be commissure to commissure or buccal to buccal of the patient's mouth. We want the technician to see as much of the teeth as possible. So again, if it's the lower teeth, you're going to retract and pull out. We're going to see the whole thing. If it's the upper teeth, hey, retract. And try to take the pictures on the occlusal plane. If on the occlusal plane, when you're taking the picture, if there's a lot of reflection on the patient's teeth due to the shape of the patient's teeth and things like that, then take a picture straight on first, and then maybe go above the occlusal plane. Then maybe a little bit distal or a little bit on the mesial side. Take several pictures, sometimes even a headshot that technicians would like to see. So that's about all. That's as much as I could, that comes to mind with this. I want you to call me if you have any questions, and please use the telephone number that you see below and give me a call. I'm here all the time for you. So just give me a buzz.
So let's get started. First, I want to introduce my wife, Lauren, who happens to be an expert with cheek retractors. So go ahead, Lauren, put the cheek retractors in. Okay. You want to have incisal edges slightly apart. And use your finger as a rest and put the shade reference directly under the tooth you want to take a picture of. Like the central incisor. Move the camera in, square it up with the tooth, focus, and shoot. It's okay to take more than one picture, because one picture may be better than another one. So I'm going to change the angle of the camera a little bit higher up, take a picture that way, in a superior way, and then bring it down, lower. And that way your ceramist can get a better look at the picture. Now for a lower tooth, retractors in and put it down like this. Chin up for me just a little bit. I'm going to square up to the tooth, put it directly under, move the camera in, focus, and shoot. Now if you want to take a picture more posterior, you retract back this way, then bring this up. Okay. Notice two retractors. This one here is just to keep the lips apart. I'm squaring it up, the tooth up to my head. In other words, to my eye level. I'm shooting the picture square onto the tooth. Put the shade reference directly under the cuspid. Move in, focus, and take a picture. We want to be sure that the gray, black, and white can all be seen in the picture. Now we're going to look at some common mistakes. Don't point the camera directly at the reference. And also don't use your overhead lighting. Now you don't want to be zoomed in too far. You need to see all of the references, especially the gray. Also, don't come in sideways. Photography is very important with ShadeWave. That's why we developed the new shade arm. It locks in with any camera, or most any camera, the distance, angle, and position. Let me show you how easy it is to use. Retractors in. Okay, move them up a little bit, point, and shoot. After viewing the video, I have a couple things I'd like to add. One is on sanitation. Go ahead and use a cavi wipe to wipe down the handheld. Don't autoclave or put it in cold sterilization. Also, make sure when you're taking the picture, do it before the prep. And that way all of your teeth will be hydrated. I hope you enjoyed the video, and don't hesitate to give us a call at the number below. Thank you.